Thank you, Said. So I'd like to talk fungal PJI and adult challenge. The occurrence of fungal PJI is rare, only 1%. We review English literature from 1996 to 2017. Only 162 cases included. The main organisms are Candida species. Compared with bacterial infection, fungal PJI with follow clinical feature, insidious onset, and rarely with fever. A history of long-time broad-spectrum antibiotic usage. It seems no significant difference in change of inflammatory marker. A history of repeat surgery. There is no reliable guideline for treatment. So that makes this treatment so difficult. Along with most of patients with immunocompromised status, the biofilm has highly heterogeneous and forms rapidly. Surgical treatment is still a main procedure. Let's look at the outcome with different procedure. Tear and joint resection. This multi-center study from Spain, they report 35 cases with mean 6-year follow-up. For tear, the failure rate is very high, 73%. For resection, a little better, 35%. Two-stage revision still regarded as the gold standard in treating PJI. This study from Mayo Clinic, 31 cases. For hip infection, there's 3 reinfected. For TKA, the total success rate was 54.5% at final follow-up. There's also a multi-center study, 31 cases. The failure rate is nearly half. So it seems the amphotericin B loaded spacer, it doesn't work. So from literature, it's very hard to detect the release of this drug in fluid. How about a single stage? So the study from Gurkey, 14 cases. A total of 10 patients were available for follow-up with 7 years. 80% success rate. Fluconazole and amphotericin B are most used for most of cases. But nowadays, these 3 drugs, it seems have a more ability to bone penetration. So the duration of treatment is so different, from 3 weeks to 38 weeks from literature. The IDSA recommend 6 to 12 months. So I hope everybody keep in mind. About 1/3 patients combined with bacterial infection. So vancomycin and imipenem is recommended as a combined agent. In my department, we do single stage from 1997. So effective protocol have been established from that time. So in my department, I routinely do single stage. I don't want to say more about how to do debridement and reconstruction. Everybody know it well. For hip, I put a catheter for intra-articular infusion of antibiotic. For knee, just direct injection after surgery. Our data, 11 fungal PJI. At 5 years follow-up, the success rate is 3.6. The success rate is also higher than two-stage. From 2014 to now, another cases get treated, but the result is not encouraging. One amputation, one recurrence with antibiotic suppression, one good so far. So, in conclusion, fungal PJI have a very relative low rate of infection control at present. Revision surgery should be performed in experienced center. We should create optimal condition before revision surgery. Is there any new and improved method? I don't know. But probably intra-articular infusion of antibiotic is going to be a best way in treating PJI. Just like Dr. Morgan Jones said, you should take a shower firstly, then put perfume on your body. So if you want to do intra-articular antibiotic infusion, firstly, you should do debridement or one stage or two stage. Thank you so much.